Dr. Ava Thompson stood under the bright operating room lights, her brow furrowed as she peered into the surgical loop. She had hoped to avoid performing surgery, but her attempts were causing the boy too much pain and suffering. The only remaining option was to sedate him and proceed with the operation. What was causing the boy so much pain and discomfort that made the doctor herself uncomfortable? Find out in today's story, and we'd also love to know where you're listening from. Today, Ava faced an unprecedented challenge. A live insect had become lodged in the ear of a little boy. It was her first time encountering such a case, but she was ready to face the challenge. 5-year-old Ben Collins, clutching his head and pulling at his ear, had been admitted to the hospital early that morning. His mother, Caroline, in a state of desperation, explained that her son had been complaining of severe ear pain. He had woken up screaming, and despite her best efforts, she could not calm him down. Ben insisted that something was moving in his ear. At first, Caroline dismissed his claims, thinking that his cry was the result of a nightmare combined with the earache. But Ben was insistent. He desperately tugged at his ear, scratching it until it bled. In an attempt to show him that it was just a simple earache, Caroline grabbed a flashlight and peered into his ear. However, when she looked into his ear canal, what she saw defied understanding. A tiny insect, with a barely noticeable head, had somehow slithered into Ben's ear while he slept. Her son had been right, and now Caroline was horrified about what might happen next. The emergency department staff immediately called Dr. Thompson, the hospital's leading ENT surgeon, known for her calm demeanor under pressure. Throughout her career, Dr. Thompson had encountered all sorts of foreign objects lodged in people's body cavities, especially with young children, who were notorious for putting random items into their ears and noses when their parents weren't looking. In most cases, these objects could be easily removed with a firm hand and a bit of cooperation from the patient. Serious surgical intervention was rarely necessary. Although Dr. Thompson had never before removed an insect from someone's ear, she was confident she could find a way to extract the creature without causing further trauma to the boy. Her first approach was to lure the insect out without resorting to invasive procedures. She carefully laid Ben on his side, tilting his ear upward, and attempted a non-surgical removal using a small suction device and delicate instruments designed for removing foreign bodies from ear canals. The idea was to create a gentle negative pressure that might encourage the insect to crawl out on its own, thereby minimizing injury to Ben. As she worked, Ben began to whimper, his eyes squinting in pain. This prompted Dr. Thompson to change her approach. She seated Ben in a chair and attempted to grasp the insect with a large pair of forceps. Although she clearly saw the insect, every time it seemed like she had a hold of it. Some resistance prevented its removal. The insect, sensing the disturbance, burrowed deeper into the canal, intensifying Ben's suffering. Ben's little body trembled, and the heart monitor registered a sharp spike in his pulse. Seeing this, Dr. Thompson realized that there was no alternative. The insect had to be removed surgically before it could inflict further damage. Now standing by the operating table, she felt the weight of the situation. It was not just the peculiarity of the case. The fact that the insect was still alive added to the urgency. Any slight movement of its body could further injure the delicate structures of the ear, the eardrum, the auditory nerves, or even the labyrinth of the inner ear. One wrong move could result in a loss of hearing, or worse, irreversible brain damage. This was undoubtedly one of the most serious cases the surgeon had encountered in recent times. Dr. Thompson carefully inserted a thin endoscope into Ben's ear, the camera providing an enlarged view of the insect's body. The insect was as thin as a pencil, its exoskeleton glinting under the stark surgical lights. It was capable of retreating in response to their attempts at removal, and any sudden movement could cause irreparable harm. Each breath Dr. Thompson took was measured and cautious. No medical textbook had prepared her for such a case. When the forceps touched the insect's abdomen, the monitor showed a further increase in the boy's pulse. The insect reacted with a slight twitch, sending shivers through Ben's body. Dr. Thompson made her next move with even greater care, gently grasping the insect's abdomen as delicately as possible. The insect twitched again, its body slightly contracting, but it did not extend further, a positive sign. Ava began to slowly pull, being careful not to exert too much pressure on the boy's ear canal. As she tugged, she felt resistance similar to that which she had noticed when Ben was awake. Something was not right. The insect was stuck. However, it was not aggressive resistance. It seemed that something deep within the ear canal was holding the insect in place. Frantically, Dr. Thompson considered all possible scenarios. Could it be earwax stuck to the eardrum? The view was not clear enough. She needed a better look. She cautiously removed the forceps and adjusted the endoscope to get a closer view of the canal. What she saw sent a chill down her spine. The insect had coiled around a small, sharp foreign object, a tiny piece of metal embedded in the eardrum. It appeared to be a part of an old toy that Ben had likely inserted into his ear secretly, possibly months earlier. The presence of the foreign object made the situation even more dangerous. Now, Dr. Thompson not only had to remove the insect, but also had to avoid disturbing the object, which could easily damage the eardrum further or cause even more bleeding if pulled in the wrong direction. Removing the foreign object was already a delicate procedure on its own. With the insect wrapped around it, the task seemed almost impossible. It was clear that the mother had no idea about this object. Yet, the boy surely remembered inserting something into his ear, if only he had mentioned it before being sedated. If she had tried to pull the insect out at that moment, she might have dislodged the object, causing catastrophic damage. On the other hand, if she attempted to remove the object first, it was uncertain how the insect would react. It was a huge puzzle with no obvious correct answer. Her mind raced with calculations. Dr. Thompson knew that haste was not an option. One mistake could cost Ben his hearing, or worse, she needed to immobilize the insect's movement. An assistant handed her a special tool resembling a tiny hook, designed to maneuver within confined spaces. With exceptional care, she positioned the hook in place. Her goal was to carefully extract the foreign object without alerting the insect. This required patience and utmost caution. Dr. Thompson understood that once she secured the object, she would have to act quickly before the insect realized what was happening. Taking a deep breath, she finally managed to extract the foreign object, carefully removing it from the boy's ear. Now came the most critical moment. Without the foreign object in its grasp, the insect could panic, thrash, or even bite. With her heart pounding, Dr. Thompson focused on the insect once more. Taking another deep breath, she repositioned the forceps and cautiously grasped the insect by its abdomen again. Slowly, millimeter by millimeter, she extracted the insect. This time, there was no resistance, but the surgeon was careful not to celebrate prematurely. Only after the insect was completely removed did she allow herself a moment of relief. The next step was to examine Ben's ear and ensure he was stable. The boy's life had been saved, though it was clear that Dr. Thompson would need to have a serious talk with him about inserting foreign objects into his ears. Although the insect had not been his fault, he had complicated matters by inserting toys into his ears, which nearly cost him his life. In the following days, Ben surprisingly recovered quickly. The damage to his ear was minimal, with no signs of neurological complications. His hearing remained intact, and his parents were immensely grateful to the surgical team for their efforts. The insect, identified as a harmless species, was safely released. In a strange way, the insect's accidental entry into his ear turned out to be a fortunate twist of fate. What do you think about this story? It is pretty common than we think, and in case of some discomfort in your ears, it's best to get some medical help before it's too late. Please share your thoughts in the comments below. If you enjoyed this video, be sure to like and subscribe to our channel. Thank you for listening to Storyline Narratives.